procedure I'm going to go over with you is falling or fainting. So if you come across a resident who is lying on the floor, the first thing you do is call for the nurse and stay with the resident. Always stay with your resident in case of an emergency. The next thing you want to do is check to see if they're breathing. If they're breathing, do not move the resident. Do not move the resident until the nurse arrives. While you're waiting for the nurse, you want to be calm and supportive. Apply pressure to any areas that are bleeding. Take pulse and respirs while you're waiting for the nurse. And then just assist the nurse as directed. Check them frequently according to facility policies. Thank you for watching. The next procedure I'm going to go over with you is choking. So if you come across a resident who is grabbing or clutching at their throat, first thing you do is call for the nurse, stay with the resident. You have to ask the resident, can you speak? Can you cough? If they are not able to speak or cough, move behind the resident, place your arms under their armpits, and your hands go midway between the waist and the rib cage. So the fist goes up against the abdomen between the waist and the rib cage. The other hand goes over and you make inward and upward thrusts. In and up until the object is expelled. Assist your nurse with documentation. Thanks for watching. The next procedure I'm going to go over with you is if somebody is having a seizure. So if you come across a resident who is having a seizure, you call for the nurse, stay with the resident, put padding underneath their head, move furniture away. Do not try to restrain them, do not put anything in their mouth, and assist the nurse with turning them onto their side. That's going to prevent choking should they vomit after the seizure. You want to loosen up their clothing around the neck. After the seizure is over, if the nurse was not there to witness it, you want to let the nurse know the duration of the seizure and the areas involved. Thanks for watching. The next procedure I'd like to go over with you is how to respond to a fire. So if there's a fire in your building, we use the acronym RACE. R-A-C-E in that order. R, remove the residents from the area of immediate danger. So if the fire's in their room, get them out of their room. If the fire's in the hallway, get them out of the hallway. A, activate the fire alarm. That's how we alert the entire building at once that we have an emergency. C, close doors and windows to contain the fire. And E, extinguish the fire with a fire extinguisher if possible. Make sure you follow your facility policies and procedures. Thanks for watching. The next procedure I'm going to go over with you is how to use a fire extinguisher. So when you're using a fire extinguisher, we use the acronym PASS. P-A-S-S. You pull the pin, aim it at the base or the bottom of the fire, squeeze the trigger, and then sweep back and forth at the base or the bottom of the fire. Thanks for watching.